not feel like it today, but summer is right around the corner.
And with the warmer weather, the higher risk of the Zika virus spreading.
Federal health officials are pushing states and local governments to make plans to protect pregnant women from this serious infection.
Dr. Brian Baer is here with us to discuss this important topic. So where currently in the U.S. is this Zika virus kind of hibernating it?
Well, that's the question and the big concern. We have a graphic that we're going to put up that shows right now where the Aedes aegypti mosquito has been found, and it's pretty much the whole southern half of the country and most of the East Coast. And with the advent of warmer weather coming, the spread is a sure thing. And so what's important for people to remember is that when you talk about travel-related infection versus locally acquired, in the continental United States, there have been no locally acquired infections. In Florida, there have been 74 travel-related infections, but in Wisconsin, 0. So where they're studying locally acquired infections is in Puerto Rico, because there have been 93 via actual mosquito bites.
Well, how is it transmitted? And if you are bitten by an infected mosquito, I mean, does it depend on your immune system?
Well, I think those are all things that the CDC is currently studying, as well as potentially a vaccine, but it is spread by the mosquito, and we also now know that it's spread via blood and semen, and it actually lasts a lot longer in the semen. The scary thing is that when women are infected by it or have it in their bloodstream, it readily passes to amniotic fluid and can impact the baby. And we've all seen those pictures of babies with small heads. It's really quite frightening.
How long can it incubate in your system before you know that you even have the Zika virus?
Well, it's thought to run its course over a 2-week period of time, which is where we get the actual recommendations about that the CDC has put out now that are more current.
So the CDC is recommending what? If you're trying to conceive, you have travel plans, what should you be doing?
Well, exactly.
Which one, I guess, should you not do?
Most important is if you actually have had an infection and it's been documented via blood testing, then you should avoid getting pregnant for 8 weeks. If you've been exposed to someone who's had an infection, avoid getting pregnant for 8 weeks. If you're a man and you've had an actual infection, you should avoid conception for 6 months.
So quickly though, if you go to one of these countries where the Zika virus is present and you feel fine, should you take a test before a blood test to determine if it's in your system before you try to get pregnant?
If you are concerned that you've had an actual exposure, it'd probably be a good idea. I mean, we have this graphic that shows where the Zika virus is, and you can see all of Central America and South America, and Cuba and Puerto Rico.
Popular places.
It's very popular travel destinations.
Especially with the Olympics coming up.
Exactly. Take your DEET and don't travel to those areas if you're thinking about having a baby.
You have heard it from the experts. If you have more questions for our experts, you can email them at asktheexpert@tmj4.com. You can also leave a voice message at 967-5253. We'll be right back.